Hello everyone, my name is Ian Kai, and today I will be discussing occupational stress in contemporary nursing practice. What is occupational stress? Occupational stress has been identified as a major health issue for both nurses and healthcare organizations. It is often experienced when our work demands outweigh our abilities and our available resources. While short-period stress can be managed by most people, it is, however, important to ensure stress remains as a state instead of being prolonged and transformed into an illness. This highlights the necessity for nurses to fully understand the concept of leadership and utilize relevant skills to mitigate occupational stress where it is encountered in the nursing career. Why is it a problem? Nursing is long deemed as a strenuous profession with high skill demands where stress is easily accumulated that leads to work burnout. The worldwide shortage of healthcare workforce is predicted to be 12.9 million by 2035 and is especially profound for nurses. Along with the pronounced shortage of nursing workforce, occupational stress is increasing drastically due to the distinct stress-filled nature of the nursing profession. Between 2000 to 2015, mental stress has accounted for 8% of workers' compensation claims in the health sector. Some stresses that are central to a nurse's role include manual laboring, long working hours, understaffing, and interpersonal relationships. The significance of occupational stress in relation to patient safety and a healthy workplace. So healthy work settings are essential to healthcare organizations in terms of maintaining staff well-being and hence uphold work productivity. Chronic stress is known to impair nurses' psychological and physical well-being, which in turn leads to job dissatisfaction and poor quality of patient care. While patient care is defined as an interpersonal process that requires positive therapeutic communication and accurate implementation of nursing expertise, the aforementioned work-related stress is acknowledged to compromise nurses' compassion and caring behaviors for patients that may consequently threaten patient safety. Studies found that nurses with significant stress level tend to avoid their patients during the care process, which in turn increases the likelihood of negative patient outcomes such as an increased fall rate on admission. What is currently being done about occupational stress? Due to the high number of work-related injuries and illnesses, Safe Work Australia has prioritized the healthcare industry to address a range of hazards the healthcare workers face on a daily basis, which includes stress. The Australian Work Health and Safety Strategy 2012 to 2022 was subsequently launched with the aim to create a healthy workplace, and one of its 7 priority action areas also addresses factors that are related to leadership and culture. Meanwhile, occupational stress is recognized by the Australian Nursing and Midwifery Federation. ANMF makes policies in conjunction with Work Health and Safety who addresses nurses' right to a healthy and safe workplace, as well as urges individuals and organizations to alleviate occupational stress by adhering to WHS legislations and eliminating work-related stress hazards. In addition, nurses are encouraged to apply cognitive behavioral interventions such as the ABC model, which stands for Activating Event, Belief, and Consequence. The ABC model can be deemed as an attempt to modify nurses' perceptions of stressful events and challenge their negative feelings about those events. The role of effective leadership in mitigating occupational stress. In light of the priority areas under WHS strategy, leadership style is one of the main factors that contribute to nurses' distress. Leadership behaviors are also associated with absenteeism and staff turnover, which have cost for both individuals and organizations. This therefore highlights the necessity of developing transformational leadership style that is more likely to promote nurses' health well-being and enhance better patient outcomes. Studies show that transformational leaders who adapt an empowering approach by establishing positive and trustworthy relationships with nurses are able to optimize the fit between workplace demands and nurses' skills. It allows space for learning while also grows nurses' self-confidence. Transformational leaders promote openness and inspire team members to share a vision which strengthens nurses' intrapersonal skills in terms of coping with their job demands and consequently reduces the level of occupational stress. So what are the clinical leadership expectations for new grad nurses? Leadership development is essential in contemporary nursing practice that is regardless of job positions. Clinical leadership can be defined as nurses' behaviors that provide support and guidance to healthcare teams and patients in order to integrate nursing care to improve the patient outcomes. With respect to the former, nurses' understanding of leadership role is shown to be closely associated with the delivery of safe and effective bedside care. Let's incorporate this concept with our responsibilities as a nurse. According to Nursing and Midwifery Board of Australia, nurses must abide by person-centered practice, meaning that advocating care in the best interest of the person and consider referral when an issue is identified to be beyond our scope of practice. In saying so, developing a leadership mindset as new graduate nurses enhances daily practice such as making decisions and gaining insights towards our roles and responsibilities. This allows us to act in accordance with code of conduct through better understanding the challenges we face at workplace and practicing within our scope of practice. Consequently, safe and sensible nursing practice can contribute to reducing unnecessary exposure to work-related stress hazards. Moreover, nurses' interpersonal relationships have been previously mentioned as one of the stressors. Studies reveal that emotional demands stemming from patients can be detrimental to nurses' psychological health, which is likely to compromise therapeutic nurse-patient relationships. Leadership skills are therefore essential for new graduate nurses to acquire in helping navigate interpersonal relationships under clinical settings. Nurses who become clinical leaders are better at coordinating patients and their families, through which potential conflicts and misjudgments can be avoided and professional boundaries are maintained. In addition, it is nurses' responsibilities for promoting personal and others' physical and psychological well-being. When patient safety is in doubt due to nurses' health issues, we are expected to actively seek support for either ourselves or our colleagues. New graduate nurses who have developed strong leadership skills are more likely to act autonomously to escalate concerns such as being overstressed, and advocate for the safety of both themselves and patients. Why did I choose to communicate this way? Provided that occupational stress is a major health issue in contemporary nursing practice, a presentation is chosen for the purpose of education, as it may create a ripple effect to facilitate critical thinking among audience. Using the format of presentation also allows key points to be clearly highlighted and comprehended by nurses in that they gain awarenesses towards available policies on occupational stress, as well as the concept of clinical leadership. Meanwhile, a narrated presentation can be a rewarding experience for myself as the presenter, in which self-confidence is increased to enhance the development of leadership skills. Due to our pre-existing beliefs, the concept of leadership is often related to nursing executives and those official job titles such as the NUM. The aim of this presentation is therefore to inform nurses that everyone is a leader in their own field of practice, and how leadership skills may be incorporated into our scope of practice to mitigate occupational stress. Thank you for listening.